if that area of injury is warm still, which means that the inflammatory phase is still very active in that injury, then I re-emphasize the ice component for another 24 hours and then a reassessment. It's not a hard thing to do. If a person gets hurt, they can usually feel that warmth in that area. It's definitely hotter. If my wife can do it, anyone can do it. So basically, if they can feel the warmth in the joint or the muscle, that means that acute inflammatory phase is still on. They should still stick to the price principle. And then after that period where that warmth is settled down, it's normal body temperature, then starting add in hot packs or hot water bottles, or now you can microwave everything. You can microwave hot packs and things like that, and they can go on to that area of the joint.
And at that point, what does the hot heat do to it after you've passed?
Basically, the heat in a simplified form is basically going to reverse the cycle of the ice, the initial acute phase. It's going to bring in blood to that area, healthy nutrients and chemicals. They're going to start speeding up the healing process. And we use heat in a therapeutic manner that in a knee injury or shoulder injury, we heat up the joint after that inflammatory phase is over again, and basically allows us to stretch the athlete out, allow them to gain some range of motion, because all of a sudden the knee joint is warm and warmth feels good. Anyone who gets in a whirlpool or lays down on their bed with a hot pack or something like that, warmth always feels good, whereas ice gives you that initial shock and analgesic feeling afterwards. But everyone likes warmth, and it allows us to be a little bit more aggressive in treating the athlete or the individual off the street.
And Jonathan, what about anti-inflammatory medications? You hear a lot about that. How often are they used, or should they be used, and what areas are they?
It's a good question.
You take over. I've talked myself into a hole here.
Not really. I think that the non-steroidal anti-inflammatory drugs, acronym NSAIDs, are very popular for the viewers. I think that's the Advils, the Nuprins, the Advils, everything but Tylenol. Aspirin is in that class. And then the prescription strength, non-steroidal anti-inflammatories. There are some very new, very selective anti-inflammatories which don't have that typical side effect of upsetting the belly and having effects on the bloodstream and things of that sort. And I think it's a real controversy. And I think that the initial feeling was that we try to block the body's inflammatory response with the ice, and then we give them medicines to prevent the inflammatory response throughout the bloodstream. We're beginning to realize and understand that that inflammatory response is actually a good thing. And while it may cause pain, swelling, and discomfort in the beginning, that it's probably not a good idea to blunt it completely by giving these overriding medicines. So to be succinct, which I already went over the phase of, I think for a few days would probably be best, depending upon the injury. Not 2 weeks, maybe 4 days, maybe 5 days, maybe 6 days, and then let the body take its course. And I really liked Jim's heat-ice philosophy, when it cools down, heat it up, and I think that really individualizes treatment, as it should for the medication. And I don't think you can treat everybody the same, and I don't think you can keep treating all injuries the same. But I think in general, a short course of an anti-inflammatory, if it doesn't have a side effect on that person, it's probably a good idea.
And as far as individual injuries to the regular folk out there, not the world-class athletes you're both used to dealing with, but how do you know when you have to seek professional help? Maybe you've strained your arm or you've sprained your ankle. It doesn't seem to be that bad. How can you tell when you should see a doctor?
I guess that's a difficult question to answer. The way that I let individuals know is if basically the injury that they've gotten on the field, or getting out of their car, or getting bumped by another person at the grocery store, if it doesn't allow you, or if the injury doesn't allow you to function in your normal capacity, if it doesn't allow you to continue grocery shopping, or if you're going home and all of a sudden you notice that there's swelling and you can't get off the couch, or you can't get out of the chair, or you can't get out of the car, that's an indicator to you that you've done some damage to whatever is injured. And that's when you should seek the care of a professional, of your family physician, your orthopedic surgeon, your athletic trainer, your physical therapist.
And I would imagine it would be hard, unless you've had injuries recurring over time, it would be hard to diagnose yourself. How would the average person know, unless they had had a lot of ankle sprains, whether they had sprained their ankle or perhaps broken their ankle?
It's a good question. I think a general rule is when in doubt to seek treatment. I think there's a time frame element. If it lasts more than 24 hours, if it's progressive or getting worse, those are cardinal signs that you may need attention. If it's something that happens again, their knee buckled and it buckles again, I think that's another cardinal sign. If there's bleeding, of course, people will go. If there's neurologic or nerve damage in which people feel numbness, tingling, weakness, those are key signs that should alert them to seek professional medical help. But in the absence of overt swelling or increase in size, which would be a sign to go to the emergency room, and if they can put weight or walk on that leg, then I think they have the luxury of waiting a little bit, icing it, doing what we talked about, general anti-inflammatories, which one can buy over the counter. If it gets better, hold off. But if the trend is a progressive one towards the worsening, then I think they need to seek attention. And I guess if they hadn't had problems in that area in the past, it may be safer to wait, where if it's a recurrent injury, maybe seeking earlier treatment may be a good idea.
Okay, now let's take a typical example, as we mentioned. Say somebody sprained their ankle, not very severely. They've gone through the Price procedure, then the swelling's gone down, the temperature is the same on both sides. Now they're heating it and doing all that. When do they know that they can go back to doing what they were doing if it were playing tennis? How do you know when's the right time?
Again, the typical, it depends on the degree of sprain, a first degree, a second degree, a third degree, the amount of damage to the ankle. Basically, if you're seeking the advice of a professional, the therapist or physician will be able to give you some direction in terms of when you can return to that sport or activity that you're involved in. People generally tend to be more aggressive than is actually good for them. They want to get back into playing tennis. They want to get back into the game. They compete. We're born to compete. And so what they want to do is they want to get out there and they want to do what they do or what they enjoy that makes them feel good. I tend to hold the athlete back probably a little more than I need to. But basically you try and, when they're functional and they can pass all the functional tests of what they have to do on the tennis court, side-to-side motion, forward and back motion, light jogging, some sprinting. When they feel that there's no pain and no reaction to that joint, then it's time they're good to go back.
And Jonathan, final thoughts on this subject?
I agree completely with what Jim says. I think to give people some guidelines and objective things to look for. Normal range of motion, normally what happens after a sprain is it gets stiff, and if that stiffness is not resolved and they don't have normal motion, then that's something to hold them back from going back to sport. If they're weak or they can't hop that many times on the affected side as they could on the non-affected side, that should alert them that they're not quite ready. And so if their strength is back and their motion is back, they should go back gradually, not trying to go back and compete the first time back out in the court, but hit a few ground strokes, see how it feels, take a little time off, take a day off, go back a day later and see how they're doing, and listen to their body.
Do you want to have it wrapped in an ace bandage, say, if it's a wrist? Do you want to kind of...
Full sense of security. I think that if your muscles aren't strong enough to support your example in the ankle injury, then they probably shouldn't be back unless they've been guided to wear a brace or something specific. Just to wear a brace or an ace bandage off the top of their head, to me, doesn't give anybody a direct help. I think they should identify that problem, and if they need support, then get the proper support, not just any support.
All right, great, gentlemen. Thanks for sharing the insights with us on the world of injury treatment. We've been talking with, or I've been talking with, you've been listening to Jim Ramsay and Dr. Jonathan Glashow. Again, guys, thanks for joining us. And remember, if you have an injury, you want to do that price thing, and we're not talking about going down to your supermarket and checking out the prices there. It's protection, rest, ice, compression, and elevation. Remember, if it's a serious injury and you feel that you may have done something really bad, you should definitely check and consult with a doctor. Thanks for joining us on this webcast on injury treatment. I'm David Folk Thomas. We'll see you next time.